சார், அனுப்குமார் சார்,
எஸ் சார், எஸ் சார்.
நீங்கள் வெல்கம் சொல்லிட்டு சுரேந்திர சாருக்கு கொடுத்துருங்க.
Good evening, everybody. I am welcoming all to our today evening's program. Today we will be discussing various homeopathic issues as usual. Surendra sir will guide me forward, and then I will be taking the class forward. Surendra sir, please take it.
Good evening, everybody. We are sorry we are not able to meet last 2 weeks. See, we got also some obligations to perform. Because it's there. Changing is there. Problems are there. With all that, India is safe for the present. We have to thank the government for taking us in a very smooth manner, as otherwise disturbances beyond control and peace, loss of peace, health hazards, everything because of our philosophy, our Vedic principles. We follow Sajik. We don't want to fight. But we are happy because of the government. We are being run smoothly under different terrains. Homeopathy is not accepted in America. No, don't worry. They are still on their own way. But more criticism is coming in American media about the system of healthcare. Even yesterday I have received a French message saying that what cost in 23,000 rupees in India has costed him 2 to 3 lakhs. It took nearly 2 months to get the medicine from India to America. All right, it's all there. So, it is better to avoid traveling to America, particularly the sick patient. Sick patient. Yes. Again we repeat our philosophy. A well correct medicine applied to a sick individual operates within the corresponding to its action will overthrow the disease. Putting the words of similia similibus curenta in a narrative. See the language. A well correct medicine applied to a sick person or sick individual operates within the sphere of corresponding to his action. That is, headache. You have chosen a medicine for headache. For example, in the dry season, Belladonna. It acts within the sphere of its limits. Then what it does? It will go through the disease. That is, it will go through the headache. That is, you are cured. Of course, sir, that is the action of the medicine, sir. You are putting unnecessary many words. It is not for others. It is for the physicians like us who are interested to adopt this homeopathic theory. It is for us to understand the medicine that you choose to a sick person based on the totality of symptoms or main symptom as the case may be, It acts within the sphere. It won't go here and there and cures. That is what the disease. On the other hand, if the reaction remains, that is headache remains, and the new symptoms appear, that is along with headache, he gets stomachache. No symptoms appear. During the operation of the drug, then the prognosis is grave, that is cure is complicated. In other words, not that the medicine chosen by you is wrong, not correct. In other words, the patient suffers multiple problems. So, it exhibits out. The theory of homeopathy is to bring things from inside to outside. So, because of this medicine, instead of cure, it is complicated, need not be feared at all, need not be taken into doubt by homeopathic physician who prescribes, who adopts, gives medicine. Understand? Because the patient has got a complications. So we have to treat according to the conditions that prevail at the aggravated conditions. Alright. I put this in a different light. I put this in a different light. Homeopathy greatest remedy on earth to the man in incurable disease is homeopathy. That is greatest comfort on earth. Greatest comfort on earth. This is a very beautifully coined word. Comfort. Medicine, when you treat the sick patient with homeopathic medicine, it not only gives cure, but gives him also comfort. Sir, you earlier said that when I given medicine for headache, instead of headache he got another stomachache also. Yes, we choose according to the symptomatology or the difficulties expressed by the patient. Alright, we are given only simple medicine. Belladonna is only a simple medicine. When it aggravated means, so much is the complexity of the condition of the patient. You should not be perturbed. Let the patient be perturbed. You come in and make alternative medicines. You choose again medicine. Belladonna followed by lycopodium or other medicines. You also see how he got the headache, the stomachache, what he has taken during the treatment of the belladonna. What are the medicines? He says, I went to high party. So that cannot be linked to belladonna. Okay. Homeopathy is the worst failure on earth. You answered me. When cure is not taking place, that means it is the worst failure on earth. What do you mean by failure on earth? Because nobody can cure it? Yes, no other medicine can. People are coming from modern phone. I heard on WhatsApp a native man saying that he puts, it is from Mettupalayam, that is 30 to 40 kilometers from Coimbatore. He puts 3 drops of leaves, extract, medicinal juice on the ear, not on the tongue or any other place, on the ear. He says it cures 18 types of diseases. A colloquial man describes about all the concepts of the modern difficulties, cancer, asthma, everything in his own language. We know that cancer is said to be incurable. AIDS, acquired immune deficiency syndrome, is said to be incurable. But homeopathy penetrates, tries to penetrate, tries to cure. I have already told you 2 times or 3 times. The Jnani, Kanji Periyava, he is not a doctor. When somebody asked him about food for cancer in the kidneys, he suggested Vasambu. In Telugu, Vasakamu. That is, you give it, you burn it, churn it and give to the children, babies, when the milk is not digested by them, heat comes and we apply on the stomach. So, native drugs are more powerful. They are converted into homeopathic way by the modern homeopaths. We have got about 100. Previously it was 50 to 70. Now we have got 100 to 200 medicines of native drugs. Indian drugs being converted into homeopathic way of potentization. If the homeopathy fails, it's about to fail. With all these concepts, why I am telling you again to imbibe confidence, give you confidence on this. Just because you have taken the medicine for a week or so, it is not giving you much relief. Do not be perturbed. Go and again see into the repertory. Also see how you have learned in understanding. Yes. Hypericum cures in many conditions. Hypericum helps in injuries, especially nerves, yields relief from sharp shooting pain, protects soothes damaged tissues, eases numbness, tingling, burning, repairs and restores nerve function. Injuries to fingers, toes and spine is cured. Crushes or pinched nerves, relief is provided. Understanding its role in nerve damage, mitigating pain, promoting healing. If you see these words, you can see the Hypericum capsule. I have already given to Mr. Anup Kumar, I think, and otherwise before next week I will give it back. That is, Hypericum is called this way. Yes. So like that, fearful fever. Fever. What is their fearful fever? Some are dead if fear comes, if the fever comes, they get out of control. Understand? Fear of anxiety, apprehension, F. Exposure to cold, dry air and wind, E. Anguish, restlessness and tossing about, A. Rapid onset of symptoms, sudden and intense. This is a condition where fear can come in because rapid onset of symptoms, sudden and intense. Where you are handicapped, you don't know what to do. So there fear can strike along with fever. Fear of death, panic and dread. If temperature crosses 102, 103, naturally you get panic. Even in spite of all medical applications and trying to bring down the temperature, then fear comes in of death and other things. Urgency, intense thirst, times. Three different concepts. Urgency, mood. Urgency means feels appetite or thirst or you require it immediately or something like that, or intense thirst or sometimes dryness. Or all the three are correlated. Lacrimation, tearfulness and red eyes. Euphrasia simply is better, but in fever it exhibits red eyes, lacrimation, water discharging from the ear, flushed face, hot forehead, cold extremities are different characters. Yes. I'll go to another thought. So I will take another 10 minutes, Mr. Ahmed.
That's fine, sir. Go ahead, sir. Go ahead, sir.
Yes. See, there are immense ladies' problems for them, which they don't express because they want to hide it for very many reasons. The thing is, equally they are affected, like men. But their problems are particular because of their other things. Uterine tumors, enlargement of uterus, leukorrhea, cramps in the feet, menstrual pain and discomfort. These are the problems where Fraximus americana comes. Fraximus americana. Mother teacher is best. Zonosia ashoka is a top drug used in women's sexual problems. Menstruation is late and irregular. Menstruation does not come on its because of the suppressed menses due to the medicine. Because see, in the family there is a marriage code. So they postpone their menstrual cycle. This is a dangerous thing. If menstruation does not come in of it, or suppressed or due to medicines. Zonosia Ashoka. Electric sparinosa. Anemic girls, pregnant women with uterine discharge and discharges of leukorrhea, electric sparinosa comes. Sinusitis, pain before menstruation in women, menstruation profuse and clotted in the form of clots, in spots fall on the faces, some spots will appear on the faces. In the young girls, it will be the medicine, that is sinusitis. For ill effects of suppressed sexual desires in women, or the sufferings caused by too much sex, corneum. Similarly, patient presses her breast with her hands, and is the best medicine. Increased sexual desire in women, scratchy leukorrhea, pain in the back, which is more after menstruation, Bovista. Menstruation stops in women. If menstruation stops due to soaking feet, that is, women who work in the domestic servants or who works in the fields where they are soaking feet, always they will be in the water. If menstruation starts late in the night or in the anemic girls, Pulsatla is the best medicine. If the woman has bleeding instead of menstruation, bleeding is continuous. Severe constipation, dry cough, pain in the joints will be more. Rheumatoid comes. The menstrual organs are very thick, menstrual organs, because of various medicines taken by them. Diabetes comes. Women can use for the severe menstrual pain belladonna, Metformin, Chamomile. These are the meals. You should note it down. Belladonna, Metformin, Chamomile. You can keep it in the house for all your women folk. The pain is there in menstrual time. You give them Metformin, or Chamomile, irritable Chamomile. I will hand it over to Anupama. Thank you.
Thank you, sir. So today we will discuss fevers because the weather is changing and all may be hearing about the fevers which are different types of fevers which we are seeing. So we will first know what is fever and then we will see how homeopathic will help for fevers. So what is fever? Like when our body has fever, what is actually happening inside? When we have illness or infection, our body temperature will rise that its normal range. So 98.4 will go above that to 99 or 100 or something like that. This is called fever in the common terms. So fever could help the body to fight back the causating organism which is attacking our body. They will be inactive when our body temperature rises. So that is a natural mechanism to kill or to stabilize or weaken the attacking organism. So the fever is a natural method, and actually it is good for our system when there is a problem. So, but it might also cause us, we may feel hot and may have body pains. If an adult has fever, one may not need to see any doctor because it is an adult and his body is uncomfortable weight and all. The fever can settle down within 2-3 days. But if it's a baby, and it's better to not to sit around. If you can't analyze the problem and baby cannot tell us the cause of that, then we have to take medical attention. Allopathic method where they have scans and scopes and all those things, that can help us to find out where the actual infection is and why, and we can save the baby without ending up in complications. Fevers may be high, the body temperature of more than 101 degrees Fahrenheit or 38.3 degrees centigrade, either continuous or intermittent, lasting for at least 3 days. It may be high body temperature of 101, which is with the unknown causes, and even with after extensive diagnosis test, the cause may not be found also. So that is how the viewers people keep on checking the thermometers. And normal body temperature, all of us know from our childhood days that it is 98.6, but it is outdated now. New studies after research shows 98.6 is gone, and it's an old story. At the present, people are slightly cooler than the 98.6 degrees Fahrenheit normal temperature, because of the less physical activities and the sedentary lifestyle. Our temperatures have come down to 97 and 99. That is the temperature between 77 and 99. So it can be between that. Our body temperature can change through the day. We are at the coolest during the night and warmest at the evening. We get warmer if we do some exercise. Temperature I showed you 97.0 degrees Fahrenheit. So our body temperature is higher than normal, but it is lower than 100 degrees, 100.4. It's called low-grade fever. And when we have a feverish feeling and it is lesser than 104 degrees, it's called low-grade fever. The mild illness like cold or ear infection or any other infections may cause this fevers. Somewhere there will be some infection, that is why the body is having low-grade fever. Some people may have low-grade fever after vaccination. If the fever doesn't get back to normal in a few days, we may have to consult a doctor because we don't know what is really happening. So we have to take that attention. So how does the fever affect our body? If we have fever, we may feel hot and sweaty. If the temperature falls to normal, we also might shiver, and because we will feel a little chill because of the fever. Our body temperature is high, but our inside we will feel chill, and so we will shiver. Overall tiredness, weakness and body aches or fatigue could happen. We may also have symptoms like days illness. What is the cause of the illness? Some earache or headache or whatever, some infection going on in the throat. So those areas also will be there, and the problem will be there. And we may, and caused by fever such as like cough or sore throat or whatever is causing the fever will be also felt. Food may not taste good. We may have a bad mood towards everything. For children, the fevers may be a bit more severe. Some children may have something called febrile seizures, that's fits we call it, when the body temperature goes very high and brain is heated up. So these are the physical symptoms of people when they go through fever. The body temperature rises. Some are hot and sweaty. Up to 4% of ages 6 months to 5 years may have seizures with high fever. So after that, the body learns to balance it. So children up to 5 years, we should make sure their fever temperature is not rising high. We have to make sure we are cooling the brain by putting a wet cloth on the forehead when they have fever, so the brain is kept cool and the brain temperature won't rise up back to end up in seizures. They may seem to faint, and their bodies will become stiff, shaky and twitchy are possible too, but these should stop within a minute. And doctors consider febrile seizures as harmless, but to be safe, we should discuss this with the doctor as soon as it is noticed. The reason is sometimes it can be due to some underlying complications. Sometimes it can be very simple also. So we should not sit back and think it is simple. So always make sure things are in the better control. So you can see this is how the children react after febrile seizures. Their bodies will be arcing. Sometimes it will be different stages. So it is very pathetic and sad to see these sort of reactions by the kids. So we have to keep their brains cold when they have fever. Fever is a part of a defense mechanism. This is more interesting. So why do we get fever? Fever is a part of a defense mechanism. Our body may raise its temperatures to help us to fight an infection. The reason is every infection what is entering into our system, the bacteria or virus or fungus or whatever, they like to have an optimum temperature of our body temperature to fight us, to attack our tissues. But when they are microorganisms and they don't have a self-heating system like we have, when we raise our temperature, their system also will get raised and their functions cannot be completed as they normally do. Their multiplications, their attacking powers, and they become weak. So that is a natural mechanism where our body generates heat, and our body, when our body is hotter, it makes it harder for the virus or bacteria to survive, as they would like to have our normal body temperature to function. Our organs too will find it difficult because our optimal temperature is raised. So our organs also will not work according to its normal condition, because it's a condition around it has become abnormal. Temperature has rise. Our enzymes work only in normal body temperature. But when the priority is to disable the intruder, our normal activity can be postponed. When it is postponed, that's why we have all the associated problems: tiredness, weakness, bad taste, bad mood, aches and pains. Everything comes because our normal function is disrupted. But the common causes, the main causes to inactivate the intruding pest, parasitic virus or bacteria. That's why we don't have taste of our food. We do not have hunger or feel very tired even to walk during fever. The fever also triggers the immune system to make more white blood corpuscles and to fight the intruder. So a fever may help us to protect us from the problems, even if it makes us feel worse for a while. So if the fever, don't get panicked. Something good is being done by the body against the bad what is entered into the system. So we have to cooperate and be literally safe, not to load the body with unwanted food, mind food, and rest is important when you have fever. Keep the brains cold. How to check the temperature? Thermometers can measure our temperature by mouth, ear, armpit, forehead, or through rectum. For older kids and adults, the most accurate method is by mouth with an oral digital thermometer. Rectum is best for babies or small children. To take temperature, the rectum may put petroleum jelly on the thermometer tip and insert it in about a half an inch into the rectum and hold the thermometer still till we get the results. So for adults, it is mouth and armpit or organ waste, and for babies where we cannot allow them to handle the thing. So we will put the thermometer in their rectal areas so that it is safe. This is the other method of checking temperature. For babies, if our babies have fever above 100.4 or above, or higher, we should discuss with the pediatrician immediately so that they can find out if the fever is a sign of something more serious. We have to keep the baby's brain cool by placing a wet cloth on the forehead to avoid seizures. This is important, everybody should remember. I kept on telling this always so that the baby will not slip into any seizures. No matter how high the fever is, reach out to the doctor if a seizure comes with it. Same way, if the baby's temperature drops below 97.7, would mean the baby is sick and his vital activities are not normal. This too can be discussed with the pediatrician and get immediate help, medical help. So when the baby has fever, the activities, everything will be low. They will be, crouching and continuously sleeping or becoming inactive. So that is the time when we know that baby is not well. We have to take care of the baby. Otherwise, babies are normally very active and bubbly. So for children, seek medical help if the child's fever is above 104 or a fever lasts several days. So also discuss if the temperature does not drop after medicine or medicine to lower it. So if you give medicines to lower it, the temperature start dropping, and if the fever is above 102 after a vaccination, also alert the doctor if the child seems to be too sleepy, if the child does not drink or pee enough, or if the child has a febrile seizure for the first time. If the seizure lasts more than 5 minutes, even if it is not the first time, treat it as a medical emergency and quickly attend to it accordingly. This is an area where people, now we have our grandchildren and people around, so we have to be very alert and attentive when the children is suffering. It's fevers, we have to touch the forehead and see whether the fever is there. Thermometer can be used after that, but initially don't run for thermometer. For adults, if the body temperature is above 103 or higher, and or the fever lasts for more than 8 days, or the number doesn't drop even after giving medicines to lower it, reach out to the doctor. The medical help has to be sought if the patient has not drunk enough fluid or peed enough, or if he had vomited many times and can't keep fluid inside the stomach. Visit the hospital emergency department if the patient is having fever with bad headache, stiff neck, and new rash or mental confusions are there, or if the temperature is around 105 or more. So these are the things for adults. So we have to be very careful if these conditions are above the normals and if it is remaining. So taking rest is the best thing for adults and even children also, but children may run around when they are acting, so don't worry. When they feel sick, they will come back and lie down. So should we bring down the fever? If patient is unable to eat, sleep or do anything like reading or watching TV, we need not try to lower the, if the patient can do all those things, like reading, watching TV, then we need not worry about bringing the temperature down, because fever itself may be able to fight the illness by itself. If the child gets febrile seizures, suitable medicines may be given to them to feel better, but medicines may not make seizures less likely in future. So we have to make sure that seizures don't happen in the first place, and this is the thing. So if we are able to manage our other difficulties, then we don't worry about bringing the temperature down. Let the fever take its own course and finish the job what it has been raised for. So let us wait for that. It is normal and bearable. So maybe we have to engage ourselves with less strenuous activities. We can concentrate reading and non-nuisance better. Over-the-counter medicines like paracetamol, acetaminophen, and ibuprofen may ease the adults if fever in adults, and children are older than 6 months. So patients 3 to 6 months old, low fever, lower fever, intake of fluids and good rest should do the trick. So there is no need for medicines. Rest and lot of fluids and all should work. But consult a pediatrician if the baby becomes irritable, and adults can use aspirin, but never give it to children. Wearing lighter clothes may help. Getting covered with a light blanket and drinking cold liquids also is helpful. Lukewarm shower bath or sponge bath may also help the people to cool their body temperature to a large extent. Placing a wet cloth on the forehead can help in keeping the brain cooler and help the recovery quicker. So when you cover with a blanket, just avoid covering the head, because heat is generated to the head, and if you cover it, the heat will come falling back into the head again, and it will be difficult for the patient. So the sponge bath is good, the temperature can come down. Wet cloth on the forehead is also explained. So what is fever of unknown origin? This is important. So when there is fever and there is no known causes, the temperature reaches up to 101 on which are on and off for at least 3 weeks of with no known cause. We all know that fever is a symptom of other medical condition, so the doctor will have to do some tests to narrow down the cause and determine how to treat the underlying illness. Ideally, the doctor may prefer not to give any medication while the fever remains undiagnosed. Fever helps to fight infections such as by retarding the multiplication of the infecting pathogen, and if it is over and above that, then we have to do blood tests and all those things to find out what is causing this unrelated fever. Treating the fever without knowing the cause might reduce the body's ability to deal with the possible infection. However, doctors will prescribe drugs to reduce the fever in children who suffer from febrile seizures caused by the fever. Doctors may prescribe fever-reducing medicines if patient's heart or lungs problem is there, because a higher temperature increases the need of oxygen, and inavailability can lead to complications. So, reconditioned patients may need medication. Healthy people who have fever may be able to tide over it. Just wait and watch. And if children who are prone to fevers and which can end up into seizures, they will need medicines. Otherwise, actually, it is not required. So don't run for medication. What causes fever? Fever is a symptom of more than 200 conditions. In children, infections account for about 15% of the causes of fever of unknown origin, while inflammatory and malignant diseases account to 5 to 10%. In adults, infection only accounts for 16% of the cases, followed by curious or non-infectious inflammatory diseases such as rheumatoid arthritis. However, in up to half of the cases in adults, no cause is found. So without cause, the fever can be there, which we will not know, but something is happening inside. Doctors have to use series of tests to narrow down the list of possible reasons for this high temperature. So, causes of fever is vaccination, overheating of the body, dehydration, rheumatoid arthritis, certain medications, cancer, autoimmune disease, drug abuse, alcohol. Then, this is viral infection, sinusitis, chickenpox, malaria, pneumonia, urinary tract infection, gastroenteritis, skin infections, and sexually transmitted diseases. These are all most of the common causes which can show us fever-like symptoms. So what to expect at a doctor's clinic? So when you go to a doctor's clinic, what you can expect from them? A healthcare provider who is trying to diagnose the cause of the fever of unknown origin must look for every possible clues. The doctors may ask the patient questions about the patient's work, because some workplace contains organisms that can cause fever. Places the patient has visited recently, locations overseas, and even certain areas in the country too, which can harbor certain diseases and cause the fever. So if there is an infectious disease in some place and you have visited there, the doctors may ask you, did you go there, or almost anybody who has come from there has visited you, like that. Then the questions, exposure to pets and other animals would be another cause. So any parasites or infectious microorganisms can be conveyed from the pest to us also. The patient's family history for possible hereditary cause of fever, for example, familial Mediterranean fever, which is also an autoimmune inflammatory genetic disorder that mainly affects people of the Mediterranean area. Luckily, it is not in our area, so we do not worry about it. And the doctors will also examine the patient closely, paying particular attention to the skin, eyes, nails, lymph nodes, heart, and abdomen to see if all the areas are normal. The doctor will also take blood and urine samples for analysis and finding out if there is any foreign bodies or organisms. The patient may be guided to have an ultrasound or CT scan, magnetic resonance imaging as MRI, or post-tron emission topography, that is PET scan. So these are the common names which you all know: CT scan, MRI, and PET scan will be done to rule out any sort of problem, because these are very detailed analytic tools what we have. If the cause of the fever is still unknown, the doctor may want to inject the patient with the labeled white blood cells. So white blood cells will be labeled. That means there will be some sort of radioactive element inside the white blood corpuscle, and that will be inserted into the blood cells, and that will the white blood cells that contain a harmless radioactive compound, once injected into the white blood cells, those white blood cells travel to the infected part of the body, and the radioactivity allows the doctor to see on an X-ray where the cells have moved. So even though our eyes cannot see that, with the X-ray film and X-ray machine, it can be located where the infection actually is settled in the body, where because the WBC, which is radioactive, will go and settle in that area, and we can immediately find out the cause of that and treat that organization. If that test shows no results, then the doctor may want to perform a minor surgery or biopsy samples of, for example, of liver or bone marrow. So even if that is not WBC, radioactive WBC is not revealing anything properly, then they may take biopsy, samples of biopsy of the liver tissues and bone marrow to find out what exactly is happening. So labeled WBC, you can see like, if it is now, it will be moving into the bloodstream and then go and settle down where the infectious activities are going on, and then we can find out where these are now called, and X-ray machines can find out. So there are types of fevers. Many types of fevers are intermittent fever. The temperature is high but falls to below 37.2 degrees each day. This type of fever is seen in malaria. So sometimes it is high, and after some time it becomes normal. Then remittent fever. That is the type of fever, the body temperature fluctuates, though it falls, it never falls all the way back to normal. It will be high and then low, but it is still fever, it's not normal. So this type of fever is associated with infectious disease such as infective endocarditis, rickettsia infections, brucellosis, and among others. So these are the common things, like the fever will be there continuously, but sometimes it will be high fever, otherwise it will be low fever. It's called remittent fever. Continuous fever is called sustained fever. The fever is prolonged with little or no change in the temperature over the course of the day. So it will be always fever is there. The temperature remains above normal throughout the course of 24 hours and do not fluctuate more than 1 degree Celsius in 24 hours. This type of fever occurs in the globular pneumonia, typhoid, and the step ladder pattern. Stepwise it will increase in temperature with a high plateau. So and in urinary tract infections. So these type of continuous fever will be there in UTI, pneumonia, and typhoid. Hectic fever. Hectic fever is this type of fever. There are wide swings in temperature. Intermittent or remittent fever is considered as hectic fever with a temperature difference at least 1.4 degrees between the highest and the lowest temperature. The fever pattern is indicated as an absence of pyogenic infections. First form, that is pyogenic means first form infections, and such as pyelonephritis. So hectic fever is like that. It is continuous and it's have some deep infection which is fast-related. Relapsing fever. This is a type of intermittent fever that comes up again after days of or weeks of coming back to normal temperature. So you will have a fever, then you will be normal, and immediately after 3 or 4 days, the fever will come back again, and then it continues like that. So this is a relapsing fever. With animal bites, diseases like malaria, this fever is common. So you become normal and becomes abnormal after a few days. Relapsing fever. The doctor will advise the patient to take rest, drink plenty of fluids. The patient may be asked to stop taking medications for other ailments because those medications may be causing fever. If the patient has a heart patient or lung problem is there, or in the case of child patients who has seizure as the result of fever, the doctor may probably prescribe over-the-counter remedies to bring the temperature down for reasons we discussed about. These people need attention because their oxygen levels will come down and they will be for the complications. So doctors will give them essential care, but others, normal people, will be told nothing to do. Nothing to do. Doctors may have prescribed another medicines like acetaminophen aspirin and other non-steroidal anti-inflammatory drugs. It is advisable to avoid aspirin in children and teenagers. The Reye syndrome is a potential fatal disease that causes numerous detrimental effects to many organisms, especially brain and liver. So that is the reason why aspirin is avoided for children. Reye syndrome is associated with aspirin consumption by children with viral diseases such as chickenpox. In case of infections, doctor may also prescribe antibiotics, antifungal, antiviral drugs depending on the cause of the infections. Few medications. Nutrition and exercise and supplements. These nutrition tips may help improve the immunity. Eat antioxidant foods including colorful fruits and vegetables. Avoid refined foods such as white breads, pastas and sugars. Avoid red meat and have more lean meats, fish, egg white, tofu, such as soybean, curd and beans for protein. Use healthy natural cooking oils like coconut oil, sesame oil or groundnut oil. Totally avoid foods that are made of trans fatty acids. These are found in commercially baked foods such as cookies, biscuits and cakes. French fries, onion rings, donuts, processed foods and margarine. All these things are trans fat. Trans fat is not processed in our body, so it can cause more trouble to our system. Avoid coffee and other stimulants, alcohol and tobacco. Drink 6 to 8 glasses of boiled and cold water is good. Exercise at least 30 minutes daily, 5 days a week. While experiencing intermittent fever, doctors may suggest moderate rest. Some gentle stretches rather than usual strenuous exercise regime. So exercise is good while in fever. When the fever is normal, you will be able to get better soon. But if you are having complications, doctors may suggest to do mild stretching, not strenuous exercises. Doctors may suggest the following supplements to address nutritional deficiencies, that is multivitamin daily containing antioxidants, antioxidant vitamins such as A, C, E and B-complex vitamins, and trace minerals such as magnesium, calcium, zinc and selenium. So these will be the supplements what the doctors may suggest. Omega-3 fatty acids such as fish oil to reduce inflammation. Omega-3 fatty acids may increase the effect of blood thinning medications such as warfarin is an anticoagulant. So inform the doctor if the patient is on such medications. So if they are on medications like warfarin, any anticoagulant, so we should tell the doctor before taking the omega-3 fatty acids. Then Acidophilus bacteria and Lactobacillus acidophilus. For maintenance of gastrointestinal immune health, patients who are severely immune compromised or who are taking immune suppressing drugs should inform the doctor before taking probiotic supplements, vitamin C or antioxidants. Here are the common homeopathy as a wonderful treatment methods for fever. We have the common remedies indicated for fevers. Aconite for fever that comes on sudden and alternate with chills and heat and flashes of face. Patients may have anxiety, restlessness and crave for cold drinks. Aconite is a perfect remedy for the first stage of inflammatory fever. The patient feels his body aches are intolerable. The use of aconite should always be considered when the fever had caused after sudden exposure to cold winds. This is extreme chill. There is extreme chill in the body and the patient's desire to be covered up always. So aconite is a very good medicine. If you feel feverish, first you take 4 pills of aconite, things will be under better control. Next is Apis mellifica for fever associated with alternative bouts of sweat and dry body heat. The remedy is helpful if a person has dry fever and alternates with sweating, facial flushing and a very sore throat with swollen tonsils. Pain may extend to the ears and eyelids may be swollen. Exposure to cold air and cold applications may bring relief. So if you put wet applications, the patient may feel better. Despite of fever, thirst usually is low. the person can be very irritable and dislike interference. So it is because of the symptoms you know, and when there is a fever, it is dry, and then after some time it is very sweaty, and there is throat pain and all, it is Pellatica to be thought of. Belladonna, sudden onset of high fever with hot red face, glassy eyes. Belladonna always red. Then lack of thirst and hot body with cold hands. Hot body with cold hands. The body may be hot, extremities may be cold. This indicates the fever of inflammatory origin. Belladonna is one of the first remedies to be thought of in those cases where there is fever with pain in the throat, which is also sore, red and inflamed. During fever, head becomes hot but the feet are cold, and internally it feels cold, but externally it is very strong and burning heat. So you will feel chill also. So inside maybe you feel cold, outside is when you touch the patient. Bryonia for fevers with symptoms that are aggravated by slight movement. Patient will have body aches, predominant during the fever along with the chills. Body is cold to touch along with the chills. The patient wants to lie down still to get relief, and slight motions worsens this conditions. There is increased thirst. Symptoms get worse from down, and movement and touch, but feels worse by movement and touch, but feels better by lying down in the painful side. So bryonia, the dry symptoms we are told, and the thirst will be there, and lying on the painful side will be helpful. And people cold inside, so patient can be treated. Therum phosphoricum in the first stage of fever with slow onset. This remedy is generally used for if belladonna is ineffective. Cincinium for fever accompanied by drowsiness and weakness, lack of thirst, dizziness, and fever with tendency to faint. Gelsemium is an excellent remedy to treat influenza. It can be used in the early stage of typhoid fever with great exhaustion, dizziness, or patients preferring to be covered always. So Gelsemium is very good medicine. Bacteria tinctora. Bacteria is very good medicine for septic low-grade fevers. The symptoms of bacteria is low fevers, septic conditions of the blood like malaria, poisoning, or extreme prostrations, raised muscular soreness, chilliness and rheumatic pains all over the body, heat all over the body, and for typhoid fevers also. Bacteria is a very good medicine for septic fevers. Epitorium propagatum is for fever with bone pain. This remedy is one of the most effective fever remedies. This remedy provides quick relief from pain. The main indications is the fever is periodic, repeated at a certain fixed intervals. Since the chill stage is accompanied by intense aching of the bones, the patient shivers and shakes with agonizing pain in the head and eyes. The patient feels bruised and feels as if beaten up. It's a leading remedy for dengue fever, chikungunya, and malaria. Vistox is one of the top remedies for natural remedies for the person who have fever with extreme body aches leading to restlessness. Such patients want to remain in motion or to get relief. Vistox also is indicated for fever as a result of getting wet in the rain. So head wetting, Vistox is the we talk of. So wetting in the rain, wetting in the rain can cause fever, and at that time Vistox is important. Due to fever, there is shivering all over the body, tongue becomes dry and with stretching pain in the body, along with mental and physical weakness. Vistox is very good for head-wetting disorders. Arsenic album for fever with marked exhaustion. Arsenic album can be thought of for cases of typhoid and malaria fevers. Periodicity is marked with the body pain, weakness, restlessness, exhaustion, and aggravation at night. The complaint gets worse by slightest movement and feels better after applying heat. In the heat stage, there is an inclination to uncover as there is dry heat and thirst. At the end of this fever stage, it is cold and cold sweat. Sometimes along with fever, gastric discomfort, gastric symptoms also exist, such as gastric colic, nausea, loose stools, and heaviness in the stomach. So gastric disorders and fever, arsenic album, so marked tiredness and like periodicity, which is the arsenic album symptom. Fibrogenium is for septic fevers. It's a Nosone is used for septic fevers. Fibrogenium works as a homeopathic dynamic antiseptic for conditions like typhoid, diphtheria, fevers due to infected wounds, chronic malaria, influenza, coldness and chillness is seen all through the fever, and great heat and profuse hot sweat, but sweating does not bring the temperature down. So fibrogenium is a nosone, which is a homeopathic dynamic antiseptic, works very well for infected wounds, malaria and influenza. Nux vomica, this remedy is indicated in influenza when the persons may have high fever, violent chills along with nausea, cramping and this digestive tract or a painful cough, constricting breathing, constricted breathing, that is breathing is reduced if the flu is respiratory. So the cause, whether the causes, whether it is respiratory or something else, the breathing is restricted, then nux vomica will help. Headache usually occurs along with the holosensitivity between the sound, right line and others. So patient is often very irritable, feels worse from exertion and from being cold and cold in any way. So they feel worse and irritated and feel being cold in any way. Nux vomica is anyway a general good medicine for all the busy life people who are having an abnormal type of life, not taking proper rest. Phosphorus, this remedy is indicated for a flu when the patient has fever with easy flushing face and feels very weak and dizzy. Headache, hoarseness, sore throat and cough are likely. If the problem is digestive, the stomach pain and nausea or vomiting usually occurs. A patient who needs this remedy often has a strong anxiety, wanting others to be around and or offering company and reassurance. Strong thirst with a tendency to vomit when liquids warm up in the stomach is a strong indication for phosphorus. So anything eaten after some time, when the food is inside the stomach, it will be vomited after half an hour or so. So this is a symptom of phosphorus when with fever. Sulfur, this remedy is very useful for fever if it is very long lasting and has some lingering symptoms. Often after people who have neglected they are to take good medical care when help is needed. Symptoms are either digestive or respiratory and will often have a hot or burning with a burning quality. The patient may feel hot and sweaty with low fevers and reddish with the membranes. Heat exuding is a symptom and the person often feels worse after bathing. Here now we have discussed in length the cause and management of various fevers and also remedies indicated. Hope this will be useful for all of you, and we will remember all the medicines what we have spoken now. So that's all for now. I am concluding. Thank you very much. Thank you. Okay, sir?
Is my voice audible?
Sir, yes, sir.
Namaste, my dear homeopaths.
Yes.
Thank you very much, Anup Kumar. You have given vivid description of fevers, causes, management and treatment also. And Surendra sir also, just like Kent lectures, he has given good lecture.
Yes, sir.
I want to ask two questions. First question is, what Surendra sir told about Genosia Ashoka in his lecture. What is that Genosia Ashoka? For what purpose we have to give? Another 15 minutes is there. This 15 minutes only question hour. Surendra sir has told in his lecture Genosia Ashoka, preferably mother tincture. For what purpose we will give? He has told in his lecture, it is for menstrual problems. For ladies, generally we will give Genosia Ashoka. It is not only a good tonic to pelvic organs, pain in pelvic organs it will reduce, and it will set right female problems, menstrual problems. Along with that, if younger age ladies are there, means you can give Genosia Ashoka along with Alectris ferinosa. That also Surendra sir has told. Alectris ferinosa. So these two medicines along with calcarea carb or Sapia or Pulsadilla, whatever the medicine you have selected for the treatment of women problems, you can give as a tonic Genosea ashoka and Aletris ferinosa. Only thing for younger generation, roughly 30-32 years below. Otherwise, if any persons who are crossed 35 years or like that, if they are having bulky uterus or fibroids in uterus and pelvic organ problems also, at that time you have to give Genosea ashoka and Fraxinus americana along with the selected remedy of Sapia, Pulsatilla, whatever it may be. So many medicines are there for women. Like this we have to select the medicines and you have to go. Then only the proper cure will be there within 2 weeks maximum, 2 or 3 weeks. Any long trend disease also in women, these two drugs in a different manner we have to give. 5 drops. Suppose if you select Genosea ashoka and Aletris ferinosa, 5 drops in the starting stage you give. Some improvement is there, you can give 8 to 10 drops each. With a little water, add these two and you can take it. And the selected remedies what you have selected, you can go for that. So, Genosea ashoka is a proper drug for development of the uterus, the treatment of uterus problems and increasing the energy of the pelvic organs, along with Aletris ferinosa for below 30 years. Above 35 years are people for Aletris Fraxinus americana and Genosea ashoka you have to give. This is the thing as far as our Surendra sir as lecture is there. Now I am coming to Anup Kumar's lecture. He has told several drugs for the treatment of different types of fevers. When you will select aconite?
When it is sudden appearance,
If a person comes to you, sir, past 1 or 2 days I am suffering with fever. So for that person, will you give aconite? What the patient has told, I am suffering past 2 days fever. Give medicine. Will you give at that time aconite?
no. Why give, I think, belladonna, ammonia,
Why you are not giving aconite?
aconite is at the first stage.
Yes, exactly. First stage only. Preferably it is useful for our family members or nearby friends. For those people aconite we can give. Otherwise we should not touch a person who has fever established in his body. For those people we should not give aconite. Like that, another thing, when sweating is there in the body, then also you should not give aconite. Otherwise the treatment will be improper and you cannot treat properly. The person will come every 2 days or 3 days, this symptom is there, that symptom is there, this. So the treatment will not be proper if you select a aconite drug in this established fever. So when the, sweating is there in the body, you should not give aconite. When established fever, you should not give aconite. When you will give pyrogenium 200, pyrogenium should not be given less than 200. Is a no-so. When you will give pyrogenium?
Very high fever, 104 and above.
Yes, exactly. After crossing 102, 103, pyrogenium 1 dose daily 200. Preferably 2 to 3 days, more than that you should not give. Because after finishing the fever and he is okay means at that time he will suffer with weakness. For that weakness we cannot give. And moreover, this is September ending, we came. October, November, December, it is a rainy season or winter season. In this time, generally people get fever and any other respiratory, upper respiratory problems. Better to have Ferron-Fos 6x and Calimur 6x. These two drugs, if you take morning and evening for a period of 15 days regularly, your stamina will increase. So the attacks will not come to us. Even if it comes also, 1 or 2 doses of medicines we can reduce. So better prophylactic, Ferron-Fos and Calimur, after July or August you have to take twice a day for 10 to 15 days. Then one more thing he has told in his lecture. Bismillah, Gelsemium, Arsenicum album, baptisia and gelsemium. If he is having just shivering fever or like that, arsenic album, baptisia, gelsemium. This is the 3 drugs we have to select for general fever with shivering and everything. If he is having body pains means you can go instead of gelsemium, you can take arsenic album, baptisia and eupatorium perf. But Rustax is one of the best remedy for the treatment of fevers. When you have to give, when you should not give. First you tell when Rustax should not be selected for fevers. When Rustax should not be selected for fevers. Rustax is one of the best remedy for fevers. Remember that one. But sometimes we should not select Rustax. We should not touch. It will spoil our procedure. When you should not give Rustax. If a person comes to home with a fever and flat on the bed, just simply 3 to 4 hours he sleep. That sleep reduces or ameliorates the fever conditions. At that time Rustax you should not select. When the person unable to sleep or unable to lay down on bed, unable to tolerate the pains in the night, then only Rustax you have to give. Otherwise Rustax, when the person taking rest for 3 to 4 hours, the symptoms will reduce. At that time you should not give Rustax. When he is having night aggravation, abnormal body pains, like that. Another thing, one more thing is that when rainy season, a person who is drenched in the rainwater came to the house means immediately you have to give Rustax, Dulcamara. These things we must remember. You should not wait for that till symptoms comes and then enters into body. To that extent you should not wait. Our family members, whenever they come, for children will come for college or anything, at that time you give Rustax. If Dulcamara is there, you can give, otherwise only Rustax. If any body heat is there, belladonna you can add it, otherwise not necessary. So Rustax is one of the best remedy when pains are abnormal in the night. Then only any type of disease, let it be fever, let it be body pains, let it be rheumatism, RAGA, whatever the name you give, when the pains are aggravated at the time of sleep, and then only you have to go Rustax. Next he has told phosphorus. A person who has taken some sweet food, because nowadays star hotels are there, so many parties are there, at the time the persons will go and maximum they will load the stomach. Immediately after 1 hour if they get the fever, the best remedy is phosphorus. Generally after 1 hour vomiting will be there. If vomiting does not there, nauseating will be there, but feverishness will be there. Though stomach is full, at that time fever is there, you can give phosphorus along with some other remedy, whichever you selected according to the symptoms. Any digestive remedy you can give. Like that, continuous menstrual pains always, every month it is there means, you can go Simisif Yoga and Magnesia Fast. These 2 medicines you have to give before menses starts. Like that, 3 to 4 days or maximum 5 to 7 days if we give, that will reduce. When even after treatment also, when a lady gets the pains, then you ask them belladonna and chamomilla whenever the pains are abnormal, SOS, as and when required. These are the tips generally we have to give. Today in our class, Surendra sir has taken menstrual problems, Genosea Ashoka. From there the question has arisen. Second one, Anu Kumar has started fevers. From there it is there. Any doubts from your side, please ask. Time is there, another 10 minutes. Any doubts from your side?
I want to discuss our problems.
Tell me, sir.
Last week, one patient came to me with a minor throat irritation and started with a cough. I gave belladonna and arsenic album initially. Then that throat irritation was gone, but cough persisted. There was cough inside, so I gave Antimtat and Bryonia. That also did not reduce, so it took almost 5-6 days. Then I could not try any other medicine. I tried a SBL cough syrup also, the stronger, it has got so many medicines. So then the patient went to allopathy. Allopathy also, after 2 days, the doctor gave some cough syrup and mild medicines. There was no cure. Then they have taken a blood test. They found no problem and no infection. Still, doctor said, okay, it is some viral cough only, it will go up to 3-4 days.
Okay.
But still did not reduce. Then the patient asked for antibiotic, and now she is taking antibiotic. So there was sound, in the upper respiratory, the crack sounding is coming. But that's why I gave anti-impact, but it did not reduce. So in such situation, what else we can try?
Okay. Sir, with my experience, I am telling some few drugs you remember. When there is no phlegm in the chest, you should not take Antim-Tot. There must be phlegm in the chest, then only you have to select Antim-Tot. But your selection is good. Instead of Antim-Tot, you better select Antimonium arsenicum. There, instead of Antim-Tot, you can select Antimonium arsenicum. That part you leave. Whenever any person comes with a throat infection or throat problem, you have to select, apart from arsenic amla, whatever the medicine, starting medicine you give. Belladonna, Phytolacca is the most important drugs.
Okay.
If it is severe means Merck category drugs are there. Merck rubber, Merck iod flavum, Merck iod rubrum, Merck bin iod. These drugs are very immediate short drugs for throat. So Phytolacca, don't forget it. Any, not only gargle sound, if the slight phlegm is there in the throat means you can take Caliby, Phytolacca, Belladonna. Within 3 days, minimum 70% will reduce. After that, you can give Pulsatilla, Calimore, like that, some medicines. According to symptoms you can give. But one thing, when chest not having any phlegm, don't go for Antim-Tot. Antim-Tot when chest is with phlegm.
Yes, sir.
Then only you have to go. For instead of that one, arsenicum, Antimonium arsenicum you can give. Sometime Natrum arsenicum also will work. Seasonal. It is preferably totally seasonal. So only thing, these things if you, because sure shot, these are the not only palliative, it will give good results. Sometimes some patients are having more stamina. Vital force will be more. So second prescription not necessary. Sometimes they need second prescription, at that time you can select.
Yes. So one second, sir.
Ah.
So in that course of selection, what Mr. Johns has done, initially he gave the right medicines, but instead of arsenic, the Antim-Tot he has selected, I guess, should have taken another medicine along with the Heparsol. That's what I think.
Best, very good.
In fact, infection was there and is still there, so Ipecac and Heparsol could have been good there instead of arsenic, instead of Antim-Tot. And then, if the cough is not getting reduced after this cold infections or something, ammonium carb would have helped, I think. So just what do you think about?
Yes.
I think ammonium carb I also thought of, but I have never given ammonium carb every time. Yes.
Only thing, ammonium carb frequency you should not give. Maximum 2 to 3 days. You should not give continuously. But instead of that one, Antimonium muriaticum you can give. It is from upper total, upper respiratory, throat and till nostril. It will work. Ammonium muriaticum. That is also good remedy for respiratory problems.
So Heparsol in that stage,
Heparsol, one of the best remedy, starting remedy.
yeah, it should have been given in the first place to cut the infection so that the cause would have been immediately eliminated. So that is something which in initial stage we should give. The cause has to be cut.
Sometimes the people will come, that is a lingering cough. What you have told is, Judge sir, what you have told is a lingering cough. After treatment of the some main disease, main symptom, the lingering cough will be there. For that even antibiotics will not work. Again they will come to us. For that we have to give one thing. And you forget about
That lady also told me, sir, that whenever she gets cough, it is like this, it will not go. It will continue for some time. That is, I mean, yearly once or so she gets the cough, and it will not go easily.
Sorry.
So that is also a symptom.
One thing I am telling, you keep bryonia proper, if bryonia you have to give. Second one is, go to boric and select a medicine in spongia or senega. These two drugs are having hollowness, barking coughs, hollowness in the sound. And spongia is having iodium also, so quick response will be there in spongia. But spongia should not be given in a single drug. Added with bryonia or belladonna you can give.
Mercor for whooping cough.
Mercor, Drosera, Mephitis, all these things are whooping cough.
Okay. Just a simple thing is like initially if there is a cough and it's not relenting and there is throat related issues, just try Hepaself. It will cut the problem for the next day. There will be better feeling. And then if there is phlegm and the throat is having that noise like that, no. Sometimes Cardibi also will go because the top area of the throat, phlegm is getting accumulated and it's not coming out. Cardibi will be useful. Cardibi will come.
Okay.
Find that it will work. Yeah.
So the Hepaself is at the beginning is
Yes, that is a proper medicine.
And if the noise is not from the chest, from the throat alone, Cardibi will work.
If no doubts are there, we will close the session, sir.
So one small from general discussion next time. Sir, nowadays the many youngsters in the age group of 30 to 40 are just collapsing. And it is not exactly heart failure. Even in Kerala recently, last week itself, 2 people died like that. One assistant professor of a famous college and another girl, young girl. So now there was a discussion in the TV channel about this problem. So they were telling that it is due to the COVID effect and the what is called Covishield vaccine. And problem is blood clotting, not heart problems. Suddenly blood clots and people are collapsing. And one homeo doctor in the channel discussion told there are effective medicines for blood clotting in such cases. So, but medicine really don't discuss. So I am putting this open to yours, anything like that in our discussion.
Arnica is the best remedy.
Yeah.
Arnica is the best remedy.
Our blood thinner is Arnica only, no?
Only thing is that above 60%, nowadays 30 itself is coming, above 60% always keep Arnica and Carbovich. These two medicines they have to take frequently, as and when required. Whenever they are feeling heaviness, then they get, because Carbovich will release the carbon dioxide outside. Arnica is a blood thinner actually. Over exertion by nerve system and muscular system will be controlled by Arnica. By that way, blood flow will be normalized. And along with that, we are having Cratagas and those company of the Cratagas. These things will surely keep minimum 15 to 20 years, no problem.
And if you have this issue, fear about this COVID thing, keep the arsenic album always in the system. Like
Yes.
once in a while,
You have to take.
let the arsenic album be there. The inflammation caused by the WBCs can be brought down by arsenic album. So that is this spike protein attacked by this our vaccinations and all can be brought down by this arsenic album. Autoimmune systems get brought down. So arsenic album should be in the background always, because it will take 60 days for arsenic album to clear from the system. So at least once in a month of arsenic album you should take, so that the patient will be, along with the other medicines for blood thinning and general other symptoms, if there is Carbovich and all, is fantastic. But arsenic album takes 60 days to clear totally from the system. So keep arsenic album there by giving once a month at least 200 potency or something like that, and keep it in the system, so that patients won't be put to this sort of exposed to this sort of collapse and failure and all.
Yeah.
Judge sir,
Only in youngsters. That is a very
Judge sir, I am putting one question.
And pressure, work pressure, everything is causing them that, not normal type of behavior.
Judge sir, I am putting one question to you. You are told about blood thinner.
Yes.
For what is the blood thickening? What is the medicine in homeopathy? Because some people will have thin blood. If any thin needle is touched on skin, means blood will lose like anything. What is the medicine for that to control the blood losing? So we have to know both.
but in allopathy they give aspirin now for making the blood thin. So-
Aspirin.
No, arnica works as aspirin, but it is not aspirin. So the both works together.
Phosphorus. Phosphorus is the phosphorus is medicine for oozing of blood. It is nothing but oozer. In homeopathy, blood oozer. So if you give arnica 2 to 3 doses, automatically blood oozing will be reduced.
Okay.
You read that one. These are only tips for that. Because when we are gathering is like the very less gathering bus. We are not getting interest to take the lecture also. You see today 17, out of 17, 8 people are PHM members.
Yeah.
Only 8 people or 9 people are coming. So how we will get, you will see Anup Kumar has taken so much of patience, he has prepared that one notes and told. And Surendra sir also minimum half an hour he is taking excellent lecture. Whenever he is giving lecture I am thinking of Kent only. Like that is starting point to ending point, he will keep the class in such a manner, in tight.
Correct.
You tell your friends, because you will meet so many of our allied group members, please come them, let them come to the class 1.5 hour, every week 1.5 hour. Let them spend that one. We will also get some encouragement from us.
No, we should not get discouraged and then
Yes.
wind up. Many people are getting almost discouraged because of poor attendance. Yeah.
Okay sir, we will see you in the next week.
Thank you. Wind up now. Thank you, sir.
Thank you sir.
Thank you.
Thank you.
Thank you, sir.
Thank you, sir.